Today, we turn our attention to another critical sector, the healthcare. In any functioning state, healthcare is not just a privilege, it is a right. The ability to see a doctor, get a diagnosis, and receive treatment should not depend on your location or your income or your connections. But across Nigeria and much of Africa, this is still the reality. People are not just dying from diseases, they are already dying from being delayed, delaying access, delaying diagnosis, and delaying care. And in a world that is increasingly connected, this raises a critical question. Why is the healthcare still so disconnected? But what if that could change? What if technology could break barriers, connect doctors across borders, and bring care closer to millions who have never had it? Today on The Beam, we're asking the question, can healthcare in Africa finally go from borders to a borderless situation? Joining me here in our Abuja studios is Timileyin Oluwaseyi, a healthcare tech entrepreneur and founder of the MedXverse. He's building digital health systems at the intersection of medicine, artificial intelligence, and access. His work is driven by a clear mission to make healthcare more accessible, more intelligent, and more connected for millions across Africa. Timileyin, you're welcome to the program.
Yeah, thank you.
All right. Healthcare is a very important part of our existence.
Yeah, sure.
And as such, the first question for me today would be, does Nigeria have a healthcare crisis?
Absolutely, yes. Yes, Nigeria do have.
So you believe that there is something that needs to be fixed within the healthcare system?
Yes, sure.
All right. If that be the case, then we must get into, the whole thing that we've been talking about when it comes to borderless systems, healthcare across borders, and all the rest. So let's start by asking you again then, why does accessing healthcare in Nigeria still feel like a privilege and not a right?
All right, so basically what happened is, let me say the government, one, number two, Nigerians generally also. The issue is not just the people. If the government is not paying proper attention to rising matters in healthcare, in the healthcare sector, even the whole nation is said to be doomed, because health is the basics of life, and both the government and also the individuals generally have this issue, contributing to this issue. Number one is especially the government, which contribute to about 70 to 80% of the issue. I believe personally that most of the funds, budgets and all that should, many of those percentage of the funds should actually be going to the healthcare sector. Development of hospitals, investment in technology and applying those technology in the healthcare sector actually will help to improve quality of life. So basically the government and also the people are part of the issue. The people in the sense that today, in our current age, we still have people who take herbal concoction, consistently. And this has actually contributed to various amounts of cases, kidney failure cases.
Let's then go into what if we say there is a crisis.
Yes.
Is the problem a funding problem, or is it a failure of system and leadership? And where do we go from where we are today?
It's both, actually. It's both funding issue and at the same time the leadership problem. Basically, one of the things that I've been thinking lately is, if the government will actually really love Nigerians more, they will fund more of the healthcare sector. All this medical tourism and all that has actually been taking more than $20 billion yearly from Nigerians. So it's because if the healthcare sector is well advanced and then there is appropriate funding, governments, hospitals are well equipped with appropriate standard equipment and all, people will not have any reason to travel outside the country. At the same time, doctors will not have any reason to also, travel outside the country, relocate, not even just travel, like relocate. So this has actually caused a catastrophic, issue among in the healthcare sector, basically. So it's a leadership problem in terms of we not having a regulated system that intersect the healthcare sector and also the people that connect people with health directly. So, for example, now in US, if you dial 911, immediately you get an ambulance that comes to you within less than 5 minutes. Okay, and in Nigeria, it doesn't work that way. So, and
it's funny you say that because I needed to poke a hole there. Yeah. How many minutes does it really take for an ambulance to get to me, in your own assessment?
It depends on where you stay. Some people they don't even have ambulance in some places in Nigeria. So some places in Nigeria don't even have hospitals. And some places have private healthcare center, but they don't have equipment and all. Some healthcare centers have actually closed up because of lack of funding and, leadership issues and all that. So all these things actually need to look into.
Yeah, I think it's beginning to bother me because we are getting into a system in Nigeria where there's almost no middle class anymore. It's either you're rich or then you're poor. So if we're talking about funding and we're talking about, leadership drive and the will to make sure these things happen, we are saying that there are certain people who, by the time they fall into the cadre of being poor, they would not have access to quality health care.
Yes, as you can see, there is inflation in the country. The medication people usually buy 1,000 naira before is no more 1,000 naira. There was a time I was sick. I went to Lekki to purchase just anti-malaria medication, and I spent 18,700 naira purchasing anti-malaria medication, 18,700. And mind you, there was a time I spoke with a particular woman. Her salary was around 20,000 naira a month, and I was like, okay, so how can someone who earns 20,000 naira afford a medication of 18,700 naira? I mean, there is inflation actually, and there is poverty in the country. Not everybody have this access to afford healthcare, and which is a big issue because healthcare is what is the right of every Nigerian. Having access to proper and quality health is the right of every Nigerian, and that's one of the reasons why if there is a digitalized system that monitors every of these things, we will be able to know exactly the areas in Nigeria where there is a problem. And in terms of middle class, first class, low class, low income earners and all that, I believe there was a time I was searching on social media and I discovered that there are some towns in this Nigeria that to get a doctor, they have to travel for like 2 hours to see a doctor. So it's a big issue. And why do we have that? Is because, for example, a doctor who is actually posted at a particular area or a town might actually not be getting a good amount of money. So the person might just decide to quit. So who will take over? Who will manage the place and all that? Then in terms of improving the healthcare sector, there is something that we are not paying attention to. We are not paying attention to the fact that healthcare should not be like an option. It should be a necessity, okay? A necessity, and I'm talking in terms of it is everybody's right. It should be the government concern to ensure that either you are rich or you are poor, you should still have access to quality healthcare. So, and there is no access to loans. Loans in such a way that if someone is sick, there should be a government agency that will be like where people can go to, or in every hospital where people can access to loans, to get access to health in case they have any form of, poverty, crisis and all that.
It's I don't know, I'm really kind of feeling sad about it because we're talking over 200 million people. And from analysis, we are saying that at least well over 150 million of these people do not have access to real proper health care. That's what we're saying here.
Yes. The percentage of people who are currently on dialysis in the past 5 years have actually increased. So
this comes from pressures, this comes from taking those herbs, this comes from no proper regulation when it comes to medical care.
Okay, let's look at this problem. Now, I'm sick, for example, and I went to an hospital. While they were about to attend to me, they told me that the costs of everything, before they even attend to me, I need to deposit like 100, 200,000. And let's say my salary is maybe 200K in a month. So if I deposit that money, how do I feed, transport, family pressure, a lot of things, actually. I want to do data, buy airtime and all that. I mean, that salary is not enough. So some people go for alternative, system of treatment like ABBA medicine, ABBA concussions and all that. So you just go along the street, oh, this one cure typhoid, this one do this. There is a recent stuff lately that people say when you take a particular herbs, that it shrink fibroids and all that, it doesn't work. But because people want to have this belief that at least they are doing something
to help themselves.
Yes, to help themselves, because they could not actually afford the treatment. So the healthcare cost is actually increasing due to inflation. For example, and also I don't blame the private hospitals and all, because for example, you need funds to fuel generator, buy solar, do a lot of things. The materials and everything which will be used to actually care for someone also is actually increased. Also, they want to keep running because everybody needs to survive also. So, but because the cost is actually increasing, people are shifting into alternative way of prevention and treating themselves, which is very
we have
bad.
been also saying that has to be regulated,
Yes.
the alternate medicines and all that. But let's go into access. In the real sense, access to medical care. Can digital platforms really connect a patient to a doctor anywhere across the continent? Is it possible, or are we just dreaming?
Yeah, it's very possible. In this century we've seen doctors in UK operating patients in Malaysia, in US. We've seen doctors in different country operating another patient in another country. I mean, all these are possible. That's one of the reasons why we established a MedExVas. So basic thing is that the doctor is in his own space. The patient is in his or her own space also. So there is a platform where a patient can just sign up. You see the list of all the doctors, the specialty. For example, you have issue with your heart, you see a cardiologist. Okay? You have a reproductive issue, you can see an obstetrician and gynecologist. Okay? So you select the section, the specialty you want, you see all the doctors there, you see their position, you see everything. You book an appointment with a doctor, then you have a virtual consultation with the doctor. You see the doctor live and direct from your mobile devices. Okay, doctor asks you questions and all that. This also reduces waiting times in the hospital. So for example, a particular hospital, let's say government hospital, that maybe probably provide maybe affordable healthcare and all that, or a place where people can still afford. There are numbers and thousands of patients that will be waiting to see a doctor. And in some cases, some of these people, appointment has to be rescheduled and all that. What if they have cases, what if they have illnesses that will not make them to survive the following day? So that's why sometimes, after some patients' appointment have been shifted, you don't hear from them anymore. Some even don't know if they are dead, if they are okay, or they've gone to somewhere else to maybe get alternative system to just heal themselves and all that. So there was an encounter I had with someone. I met this person in the hospital. So this person just said, okay, I want to do this. This is why I'm here. And I said, okay, go to that office. You'll be attended to and all that. And when I was coming back, I met this person kind of frustrated somehow. I'm like, what happened? And the person was like, oh, they've not attended to me since and all that. I left my wife, my work, and blah. I was like, okay, calm down, sir. Then I cannot calm down. The man just carried his bag and went. So I think a week after, I met that man at the market. And I'm like, oh, were you able to do what you came for that day and all that? And he was like, oh, I went to buy one abs, shake the abs, and he said it was fine and all that. I'm like, oh, wow, okay. So then this person did not know that taking that herbs actually will actually alleviate the might actually solve the issue, or just reduce the symptoms and all that. And at the same time, I also increase the problem. Depends, but these people doesn't know the cost, the effect, the side effect of all these herbal concoctions.
No, but we can't say directly that the herbs and the herbal alternative are bad per se to the great extent.
I'm not saying they are bad.
Exactly.
Actually.
So, but we're saying that they can be regulated, and the problem is that we continue to go to places where they are not properly regulated.
Exactly. So that's what I'm saying. That they go to some places, even those in charge are just trying to make money. They might not even know the what components really doing. Of what is there. So all they want to do is just to make money, and because that person is in need, they want to also provide services, even though some of them does not even know the components and all that of what they are mixing and all. But what they know is that when they give people, they are fine. okay, which is a big
So
issue.
sometimes it can just be your mental faculty telling you you're doing well.
Yes,
It can
yes.
just be some placebo effect or something of that nature.
Exactly. So that's what really happens. And however, there are still some herbs that actually helps people, but not every of these, standard herbs are actually out
Out
there.
there.
So most people purchase unregulated